What's up, guys? Today I want to talk about 10 things that I wish I knew before I started studying for the NPTE. So then you can learn from my mistakes and then you can make your studying not as traumatic and you're aware of more of these things that people sometimes don't talk about. So let's talk about this today. First of all, if you guys don't know me, my name is Briana Drapp. I own PTA Elevation. It is an organization that helps students pass the National Physical Therapy exam for physical therapist assistants. I went to PTA school first, worked for a couple years, and went back and got my doctorate in physical therapy. So I've been through this twice. So I'm reflecting on both of the times. What are the things I wish I knew and things I wish I would have done differently when I was studying? So let's get into it. Number one, the cost. The total cost of the NPTE is not just like showing up and taking a test. Like some people don't realize there is actually like a cost to the exam. Like they think, oh, my school's just gonna like give it to us. No. The total cost of the exam as of when I'm recording this right now, which is in 2025, is about $485 for the NPTE registration. Now that's just to register to sign up for the test. You also have to pay a prometric fee, which can be anywhere from like $70 to $120, depending on the state, prometric center location. Really does vary by person. Last time I paid it, it was about $90. So really depends. And with inflation from the last time I took it, it was like 75. It can change. So that's another thing to be aware. And I'll be adding up all these scores here at the end on this, if you're watching this on YouTube. I'll be adding all that up so you can see it. You also have the cost of applying for licensure in your state, which can go anywhere from being about like $30 for the fee up to like $200 for some states. It can get pretty expensive. So you have that as well to take into consideration. You also need to take into consideration your practice like study materials. So you definitely want to have at least one study book, whether that can be the Score Builders exam or therapy ed, whatever works best for you. Those run about $100, let's just say, for as of right now. So you have that. It comes with 3 tests. Great, because you need to take your test to be prepared. And then you also want to make sure you get your hands on a set of PETs. Now, sometimes your school will pay for this, and that's not an extra cost. Well, you're paying for it somewhere in your tuition. But sometimes you have to pay for this separately, so that would be 2 tests. So let's just tack on another $100 for that. Overall, if we're looking at all that, that adds up to a beautiful number there. Which, as you see, I've added up. Sometimes your school does pay for the Score Builders book. I just realized my PT school did pay for ours, but it can be anywhere from like once you graduate to like paying to anywhere from like $600 to $1,000, depending on your state and what you need. And that's just to like be able to get the bare minimum to study for the test. Could you go without a study book? Could you go without, could you just study your school notes and call it a day? Theoretically, yes, I would not, I would not recommend that though. So that's where we're at with all of this. That's just to be able to go and show up for test day, pretty much. If you're just talking about your licensure fee, your prometric fee, and your exam fee, that's at least like $600. So just being aware of that before you go into testing to budget that off to the side so you're not bombarded by this right off the bat definitely makes sense. And if you think about it that way, like when you retake the test, like you're still going to have to pay the exam fee and prometric fee if you don't pass. So those two combined is could be pushing up towards like $600. So for every failed attempt, it's costing you like $600 to like retake it again. And it's also costing you like, probably $15,000 of salary, if not more, if we're talking about like that you're missing 3 months of being paid. So just take that into consideration. That's like a bare minimum. So just take that into consideration as you're, preparing for this, making sure you're not wasting an attempt. They do not take the test just to say, oh, let me see where I'm at. No, pay the $120 to reschedule if you absolutely have to. Like it's not worth it. Number two, practice exams. So that is definitely something that I wish I would have known about all the different types of practice exams out there, and they're not all created equal. So you have the PEAT, which is the Performance Examination Assessment Tool made by the FSBPT. So these are people who write the test. So these are old tests. Like they used to be an exam that was out there. So I tell people all the time, these are the best version. These are the best version of a test that you should be using. You should take the PEATs. It's non-negotiable. I tell people if they're between buying one of my products or buying the PEAT, please buy the PEAT, okay? Like, I don't need your money. You need to buy the PEAT. That is the most important thing. Like, let's do that. So the PEAT exam, as I said before, you'll get two tests for $100. Good. Those are definitely the ones that you should take. Now, I honestly view every other third party practice exam equally. It's like the PET and then everybody else. So if you're like, but I need other tests to study from. Well, like, I mean, I have my own test, but you have score builders test, you have therapy ed, you have PT final exam, final frontier. Like there's a bunch of other sources out there that offer practice exams. I would say like they're gonna quiz you like some of them are going to be geared more towards PT questions, but they're all going to quiz you on things that could show up on the test. So topics that could show up. They could be testing about like long stretch versus short stretch bandages. Yeah, the way that they word it might be weird and different, but let me tell you, that is a question that could show up on the exam. So they're definitely going to quiz you on things that are very important. So don't feel bad about that with trying to decide which one to take. The PET are non-negotiable. You better be taking those. I've seen people fail the exam solely because they did not take the PETs and weren't prepared for it. So doing that and having other practice exams, again, they're all created equal. Just find the one that's best for you. How do you best review things? How do you best study from things? Whatever works, go for it. But they're all going to test you on material that could show up on the boards. Just the wording is going to be different than the actual exam because they keep changing how they word things on the real test. Number three, the biggest thing about studying though is that it is not the same as school. So the board exams are not going to test you in the same way that your professor would. When you're taking a test for school, you're just thinking, okay, what would so and so do? I remember my musculoskeletal test in like PT school. I'm like, what would Dr. Lebeck do? Like, that's all I think about. Like when I was answering those questions, I wasn't thinking about what's actually like the best thing to be doing, blah, blah. I'm thinking, what does my professor want? Because you're just testing for the test. So at that point, you're just kind of memorizing and regurgitating information for your tests in school. But when it comes to the boards, they want you to understand all of this information all together, like synthesize all of this information, make it make sense, and put it all together. The way that they're going to ask you stuff is also super straightforward. It's research based, so there's no like trying to think, okay, what do you think that they want? Like, no, it's just like, okay, like for long stretch, short stretch manage, let's just use that. Like short stretch, we're going to use that with lymphedema patients. Whoop-de-doo. Perfect. Excellent. Like it's straightforward. It's not like, well, sometimes I've been able to use this with other patients and blah, blah, blah. And I saw my one clinical, like, no, no. So the studying for the boards is different than studying for school. The boards want you to understand the by the book way. Don't get confused with what your professors say. It's not regurgitating information. You have to understand and commit it to long-term memory. So that's why by the time we get to the board studying, you shouldn't be using mnemonics and like memorization tools really as much anymore. We need to understand everything as one big whole cookie that's coming together, basically. It's also going to be different than the clinic, and the stuff that they're asking on the board is different than the clinic, which brings me to number four. The clinic is not studying. And I know somebody's just like, but Bree, like I'm understanding the information, the big picture. Yes, you need to be able to understand everything in the big picture in real life and apply it to real patients because you're going to be a real clinician. That is important. That is why for our graduation requirements, we have to pass our clinicals, aka our internships and stuff like that. And we have to pass the board. So you have to pass both. The clinic is supposed to be for understanding how to be a competent clinician. The boards is being able to understand how to do proper chart reviews, read and synthesize information, because that's part of what your job is. So you could be like, but I'm so nice to my patients. They love me. They get along with me great. I'm like, awesome. Being a nice person does not substitute for being able to understand that you are reading a contraindication in a chart. Like it's a hard pill for some people to swallow, but the clinic is not studying. If you try to answer questions on the board like how you would do in the clinic, well, I saw my CI do this one thing, blah, blah, it's not going to help you. It's not going to help you. It's going to lead you down the wrong path. So to study for the boards and get better at what the boards want, you have to make sure that to study for the boards and what the boards want, you have to make sure you are studying specifically like exam books or like NPTE content, listening to people's podcasts or whatnot, like to be able to do well with the board stuff. If you just say, well, I'm on a clinical, that's all of my studying, or like I'm gonna work in the clinic as a tech and that'll be my studying, like that's not studying, that's working. That is being a clinician. And like being on a temp license is definitely not going to help you with that either. So being in a clinic, I think, is good for like morale and emotional boosting of like, oh, I see that this is a real thing that I'm going to be able to do. I like my job. I like what I do. I like this field. Like that all is good stuff and making connections important. It's not studying though for the boards. And I just want you to make that distinction. All right, another thing that I want you guys to understand, and you might think, but somebody told me this was a good idea. You're going to number five, you're going to get bad advice from people who mean well. Okay. So you're going to get bad advice from people who mean well. Like maybe you're going to be complaining about your studying, being super stressed out, and you're instead of being like, okay, like let me just like sit down, make a plan and make a solution, your like mom might be like, oh, you seem really, really stressed. Why don't we just like go out to dinner right now and like you don't have to study, like kind of thing. Like let's de-stress you. Like obviously they don't want to see you in distress, but like right now you need to be studying. Like you can't be doing all of this other stuff. Like you have to be focused on your studying. Somebody described it as like when you have a new kid and you have to like dedicate all of your time and it's all about you. Like when you're in that adjustment period of like getting through when you have a new kid, like it's not about anybody else. It's about you guys and that kid. Like, but like the kid in this scenario is the board. So right now, the biggest thing to understand is that you will also get advice from people being like, oh, well, just like study more when you're already studying like 6 hours a day. You actually might need to study less. And that's another point that I'll kind of talk about. So you're going to get bad advice from people who mean well. Even your professors, they might be like, oh, you're fresh out of school. Go take the boards right away. But you know damn well that you need a good like 3 months to study and you've just graduated and like it's only like a month till the exam. You're like, that's not enough time. Just because it's fresh doesn't mean it's correct. Okay? Doesn't mean that it's right yet. It might be fresh from your clinicals, which we just talked about. That's not studying. So you will get bad advice from people who mean well. The biggest thing is just saying like I'm going to seek out advice from people who are experts in this, who, will tell me like how it is and, are going to, give me the correct advice and lead me the right way. And that's about it. Because obviously, if I'm giving people advice on like the calls that I do with people, like I'm not being rude. I mean well. I want to help, but I will be honest with people. I will tell people, hey, you're not ready. You shouldn't be doing this. And there's people that I've straight up told like you are not ready. Don't do this, and they've gone through it, and they're still in like their fifth attempt because they just got the bad ball rolling. So make sure you guys are seeking the correct advice from the right people. Don't overthink it too much. And even your classmates might be giving you bad advice as well, like because they study different than you, because like not everybody studies the same. And we'll talk about that in a moment, but that is that is a big thing that you guys need to be taking into consideration. When somebody's telling you something, is this actually going to be helping me? And it's good advice, or is this actually bad advice, even though they mean well about it? So we've all experienced that. People who mean well say something that's just, it's not helpful, or it's incorrect. That's even worse if it's wrong. But number six, the review book for this test is huge. And this is something that I wish I knew going into this. I feel like it makes sense though, because it's like, okay, it's huge because this is like 2 years or a year and a half, depending on how your program was, of information that you need to know. That's all going to be tested on this 180 question exam. The review books are huge. Do not get overwhelmed by the size of the review book. I want you to take it in smaller chunks. So that's what I tell people, like the musculoskeletal section. Okay, that's like 100 pages. Like, okay, that's a lot less scary than 800 pages. When you split it up into manageable chunks, and even just like, a couple pathologies for the day, like splitting it up like 10 pages at a time, makes it a lot more manageable. So don't look at the whole book and get confused and get overwhelmed and freaked out. Like the book is huge, but it's something that you're supposed to go through in like weeks, months. It's something you work your way through. Like if you think about it, like if you're somebody who likes to read, let's say you like to read, like I'm thinking the last two books I read were the two Hunger Games books. Like I read Ballad of Songbirds and Snakes and Sunrise on the Reaping back to back. Like that's almost 800 pages. That's almost how much is in this book. Realistically, it's like closer to 700 because the last 100 pages, if you're talking about score builders, last like 100 pages of like review from your test, which we'll talk about that in a moment. But yeah, that book is big, but break it up into manageable chunks. That's the big thing. When you break it up into chunks, you're like, oh, this isn't bad. Even if you break it up like 10 pages a day. If you break it up 10 pages a day, you'll finish the book like within like a little over 2 months. It's okay. and don't overwhelm yourself. And 10 pages, that's totally manageable for one day. Sometimes you could do even more. And that's just one way you can think about it. So, like the review book is big, but it makes sense. There was a lot that we learned. Think about, like, look through all the classes of your transcripts that you took. Like, we took a lot of classes, we did a lot of things. It makes sense. If it wasn't this big, I'd be worried that I just wasted my money learning nothing. Like, it's supposed to be like that. So, break it up into manageable chunks. Don't freak out too much. The last like 100 pages of it is just reviewing of like the material and yeah, our reviewing of the test. So don't freak out too much. But another thing, people, this is number 7 that I wish I knew before I started was how to study. So I've given you guys a lot of advice so far about like how to study, what to look at, what to look for, and knowing that you're not going to study the same way as your classmates. Studying in school was not the same as studying for the boards. I used a lot of flashcards when I was studying in school. I used zero studying for the boards because if you try to make flashcards, you're just gonna like there's a couple things you can use. Okay, I use flashcards for like pharmacology to know like the drugs and stuff, but um yeah, there's not a lot of stuff you want to use a lot of flashcards for because again, it's synthesizing information. It's not like road memorization and everything like that. And even for that, I was just trying to memorize the drug names, like what is Eliquis? Like what does this mean? That was big things that I was trying to make sure I understood. But studying is different for everybody. Studying is different for everybody, and you have to figure out what works for you. And it might be different than what you did in school. And so that's why the exam can be really tough because you have to learn a new way to study. So that's something I always teach students in my course. Like I give them a bunch of different study techniques. And I'm just like, hey, here's a bunch of ways you can study things. What works for you kind of thing. Pomodoro method works really well for me. So like 20 minutes on, 5 minutes off. Amazing. I even do that for my working now. Like I'll do 20 minutes of work and then I'll go like, I don't know, walk around my yard for 5 minutes or something like that. Like it's great. But the biggest thing to understand with this is how to study for this test. So understanding practice exams are the most important thing. Make sure you take sufficient amount of practice exams. I usually recommend like 4 to 5 before you take the test. And then getting through each day, breaking up that book into manageable chunks and just not overwhelming yourself, but also committing things to long-term memory versus that road memorization. So that's a big thing that I want to help students understand. Number 8 is dealing with doubt. So as you get through this and you start going through your tests and studying, like I didn't realize how much I'd start to doubt myself, especially as I got really close to test day. I started being just like, oh my gosh, I'm not smart enough. And it was worse for my PT test versus my PTA test. Because I realized I was like, oh my gosh, like there's even more weighing on me right now. Like, oh my gosh, I teach people this for a living. If I don't pass this test, like how embarrassing, how horrible will I look? How stupid will I look? And like I was having all of this doubt. And these are all normal things to feel. Like it's very normal to be overwhelmed and scared about this. It's also very normal to like not just doubt yourself but like wonder like is this even right for me, like it's very normal to have those feelings. The important thing is when you're spiraling too much, take a practice exam, you'll realize you're doing okay and then you keep going. But doubt is a big thing. It's normal, especially as you get close, but you'll also notice you'll swing between doubting yourself and then also feeling confident, like I have put in the work, I do understand this, it's gonna make sense. So just if I just kind of wish I knew a little bit more about how, like, even though I was feeling good and I did well in school, like, I would start to doubt myself with the board studying. It happens, it's normal for everybody, but I just want to make sure you guys don't feel like, don't beat yourself up too much. That's the biggest thing that I would say about that. Number 9 is your practice exam scores. So the biggest thing is when you take your first practice exam, you might take that first like score builders test and you get like a 65%. And you're like, oh my God, that's like a D. Like, am I a dummy? Like, am I stupid? Like, how could I score that low? Like, I can't believe I did that. Like, this isn't the career for me, and you panic. You will bomb your first practice exam, even if you're like somebody who's like really smart and is like, yeah, I got this. Like, you will bomb it at least in like the thoughts of like like yourself. That's like in comparison to your own standards. So when I took my first practice exam, I think I got like an 82% on it. And I was somebody who was used to getting like straight A's. So I was like, oh my gosh, like, wow, that's kind of low. But then I realized, oh, actually, I only know 2 people who scored higher than me on that on a practice exam, like on their first practice exam, like that they ever took. Like if you get like above a 60% on your first practice exam, like let's say you're 3 months out from the boards, or even like 2 months out, like that's fine. That's okay. That's a good place to be. The passing score on the boards, guys, is like a 65 to 70%. That's a passing score. So you're like, oh, when you shift everything, like think of like curving an exam, like curve everything to your standard. So like me getting that like 80 some percent, I was like, I had a good like 15 points percent buffer for passing. So I was like, oh, I'm good. So like in my mind, if I'm like, okay, like normally our passing score on our test was like a 77%. You had to get a C plus or else you wouldn't pass. So like if I got 15% higher than the that's good enough on this test kind of thing. I guess it was more than that. I was let's say it's 15%. 50, so 77 plus 15 is like 92. Yes, I'm bad at math, so don't feel bad about that. 92, wow, that's an A. Okay, that's awesome. That's more in my ballpark of like how I would score on stuff. So, with that being said, realizing like it's gonna be okay. Like if you're scoring low and just you just get humbled by your first practice exam. And it's hard. I think people forget it's supposed to be hard. Wouldn't you want your surgeon to take a challenging board exam before they work on you? Like to prove that they know their stuff? Like it's challenging but doable. That's what we want for our patients with like progressing them through exercises. We want it challenging but doable. If everything was too easy, then we'd be letting some questionable people into this profession. We can't let the exam be too easy because that's not a good idea either. But that's why. It's supposed to feel hard because it is hard because it's a licensure exam to practice and practice on people and be responsible for their well-being physically. Like that's a big responsibility. We want to make sure we're good to go. So that's number 9 of your practice exams might implode you. That's okay. They will get better and you will do good. And as long as you're above that 70%, like you're pretty much in the clear. Don't worry about it. And then for the PET exams do not worry about your percentage. The PET exams, you want to look at that scaled score out of 800. So it would be a score, it's a scaled score. So at the top of the PET review, you will see a column that literally says scaled score. Can't be more clear than that. You'll see total score, scaled score, find the two, the number in the middle. Pretty straightforward. The last thing that I wish I knew before I started studying is that less is more. You might be like, but Bree, everybody tells me that I need to just study more and stuff like that. See, that's the bad advice from people who mean well. When you're trying to pick study materials, I tell people like pick five max. Don't have too many cooks in the kitchen. I have students who try to join multiple prep courses. I'm like, guys, like everyone's teaching you the right things, but like if you're having so many people like telling you what to do, even like professors and stuff, it's gonna get confusing. You're not gonna know what's real. And then even if everything's a little bit different and nobody's like wrong, just it's better to just stick with something that's making sense to you and clicking with you and you're vibing with versus jumping all around and freaking out. So I tell people you have 5 things you can use to study from. The PET is one of them. You have to use the PET. You can't sacrifice the PET. It's stuck there. So boom, now you have 4 left. So what are the other things you want to use to study? Is it therapy ed book or score builders book or if there's another study book out there, I guess you could use that one. But those are the top 2. Like one of those, okay, let's say you have score builders, perfect. Then you have 3 other things you can use to study from. For me, it was some podcasts. I use some podcasts to study. Maybe you're using some YouTube videos to study. I know I have all of these on my profile, but maybe you're using somebody else's prep course. Maybe you're going to some sort of like review session. I know I have mine, and then I know Final Frontier and PT Final Exam, they both have like a mega review session or like a study session leading. Everybody brands it differently. It's all we're reviewing before the test day. So finding those sort of things that work best for you and not having too many cooks in the kitchen. So just picking 3 things and just sticking with that and kind of writing that out so then you're not overwhelming yourself with like 50 different things. So that's my biggest piece of advice with that. And then also with studying, I want to say 2 to 3 hours a day is sufficient for like most days. You don't need to be studying there for 8 hours a day. You can split it up. You can do like 1 hour in the morning, 1 hour in the evening. Like you don't have to be just stuck in your book 24/7. Like you will burn yourself out. But anyways, those are the like 10 pieces of advice I wish I knew before I started studying for the board. So hopefully this was helpful and I will see y'all in the next one. Take care, everybody.